The next presenter for the day is Dunay Afam. Dunay will be joining as a panelist. I now request Dr. Dunay Afam to present on the topic Pictorial representation on non-steroidal anti-inflammatory drugs product package, influence on self-medication among adults in Alimosho LGA, Lagos State, Nigeria. Over to you, Doctor.
Okay, thank you very much, and good day to everyone present in this conference. It's wonderful presenting here today. Like has been earlier stated, I'm looking at pictorial representation on non-steroidal anti-inflammation drugs product pack and influence on self-medication in adults in Alimosho local government area of Lagos State, Nigeria. Now, the introduction, self-medication has been a worrying situation globally. And studies have shown that NSAIDs are implicated in self-medication. NSAIDs are used for management of pain, and adverse effects may be cardiovascular, gastrointestinal, and others. We also have challenge with non-controlled access to NSAIDs in our community. And the question now is, do pictorial representation on products pack influence self-medication of NSAIDs? That is what this study is going to talk about, look at. Do these pictorial representations on product pack influence self-medication? Now, there are several studies on determinant of self-medication of NSAIDs, but looking at all the studies, none has really been conducted in this particular local government area, Alimosho, and none has considered the impact of pictorial representation on consumer perception and use of non-steroidal anti-inflammatory drugs. We also try to look at the time series, use data from the regulatory authority on time series analysis to show that there was an increasing availability of NSAIDs with pictorial representation on their product pack. Now, the graphs that are presented, we can see that there is a high percentage volume of imports of NSAIDs with pictorial representation from China and from India. And then if you look at the second chart, it shows that there is an increasing trend over the years, over the period where the data was drawn from. Then the other one also talks about monthly, yearly data. You see that there's an increase. 8% of this volume comes from China and 92% from India. Now, self-medication is use of medicines in treating ailments without physician's advice in diagnosis, prescription, or treatment. This use of medicines may be from outside the medical practice. We look from advice of friends, family, neighbors, and untrained persons, online media or physical media, and then problems with previous use of those NSAIDs. For instance, if somebody had used before and advises the other person that he has used it and it worked before. So this issue of self-medication is becoming very high at the global stage, and is really high among developing countries like Nigeria. And the desire to care for health is a basic reason for self-medication. People want to take care of themselves. People are sick. They quickly run to get drugs or medicines to use. And then as a result, a lot of them go into self-medication. The regulator in Nigeria is the National Agency for Food, Drug and Administration and Control, and they have categorized NSAIDs as prescription-only medicines. Poor distribution and practice and enforcement of regulations has been a big challenge being a big challenge in enforcing the controlled use of this drug. Use of NSAIDs is readily available for patients' self-medication behavior in Nigeria, and this has been a serious challenge. Now, this this study used the health belief method that hypothesizes that combination of factors such as perception and modifying factors may lead to change in health behavior. So that's the hypothesis we are using for this study. And then it looks at the impact of pictorial representation on consumer perception and use of NSAIDs. These pictorial representations come as graphic display of pain and description of cure for such pain. You could look at the pictures there. You see pictures of people exhibiting pain and all that. So it tells the patient what that particular medication is used for, even though it is a prescription medicine. And then we also have to analyze the relationship between pictorial representation of pain on use of NSAIDs, and then formulate possible recommendations for the improvement of safe use of NSAIDs in that local government, and then the regulatory activity, policymakers, and health issues. And then we also want to provide useful information for researchers, policymakers, and regulators in the formulation of relevant guidelines and regulations on this topic. Now, the hypothesis we use, we look at research questions and then the hypothesis: to what extent does knowledge and attitude of individuals practicing self-medication of NSAIDs vary by socio-demographic profile of adults in Alimosho LGA? And then that's a null hypothesis: no significant relationship between social demographic profile and the knowledge and attitudes of adults practicing self-medication. And then we looked at those pictorial representation influence and underpin practice to self-medication of NSAIDs among adults in the local government. Now, we also looked at how can used product packs affect the self-medication of NSAIDs among adults in the LGA. The research design: this is a descriptive and inferential cross-sectional study. We use a hybrid of quantitative research that involved collection of data from adults in the LGA, in the local government, and then compare with the secondary data we got from the regulatory authority. Then the quantitative component involved use of purposive probability sampling technique for residents who have stayed at least 1 year within that local government and 19 years and above. The local government is made up of 5 local development council areas: Agbado, Kodo, Ayobor, Egbeda, Ikotun, Moso, and so on. Now we use the EpiInfo for descriptive studies, Keshley formula as prescribed by the EpiInfo for descriptive studies to determine the sample size for this study. And we calculated about 600 adults were interviewed. The formula is presented there, and then the inclusion and exclusion criteria. Inclusion criteria: those who gain consent to participate, those who are 18 years and above, and those who have resided within the area for 1 year and above, and then also those who have used any type of NSAID before. Those that are excluded are those that did not meet the parameters or criteria for inclusion. We use the software, the CS Entry app and CS Pro, downloaded on smartphone and computer respectively, to drop structured questionnaire to quantify the dependent and independent variables that were used for this study. The survey data was read into SPSS version 25 for analysis, interpretation, and conclusion. And then we did descriptive analysis, we did chi-square test, 3-way cross tabulation of gender, self-medication, and influence of pictorial representation. And then we also did logistic regression to model relationship between pictorial representation and self-medication. This study took place in, like I said before, 6 LCDAs, local council development areas. Within these local council development areas, we had 45 communities. And then we used 15 questionnaires per community, 15 questionnaires per community. And if you do that, you'll see that we had 675 respondents that agreed to participate in the study, or that were approached for the study, sorry, they approached for the study. the demographic characteristics of the 652 respondents who eventually partook in the study, 50.8% were males, while 49.2% were females. The other characteristics of demography are just displayed. I don't want to really go into those details because of time. We did a chi-square test of the results that were generated from the study. And we see that the first research question, to what extent does knowledge and attitudes of individuals practicing self-medication of NSAIDs vary in socio-demographic profile of adults? Alimosho. Chi-square was 11.9394 and difference was 1. We wonder with the measure of the strength of association between the variable cremas a small effect size. The relationship with null hypothesis shows that there is no significant relationship between gender and knowledge and attributes of adults practicing self-medication. So we rejected that null hypothesis. For the pictorial representation influence and the underpin practice to self-medication, we see that chi-square is 9.992, a degree of freedom 4, and the probability is 0.041, with the measure of strength of association being a medium size. This shows that there is no significant relationship between pictorial representatives and self-medication. Oh, sorry. Cross-tabulation. When we did cross-tabulation of this gender, self-medication, and influence of pictorial representation on use of NSAIDs, we asked questions. Did you self-medicate NSAIDs in the last 2 years? Those that medicated in the last 2 years were 73% who felt that pictorial representation influenced their use of the NSAID. And then those that said no were 7%. Those that did medicate and said that they did not get influenced were 37%. That's for males. And then for females, 73% of them said they were influenced by pictorial representation, out of which 60.4% used self-medication within that period. Then we also looked at, from this we see that 61.7% of those who responded were influenced by self-medication. Now, logistic regression analysis, this was to ascertain the association between demographic characteristics and influence of pictorial representation on product pack of NSAIDs. The overall model was statistically significant, and the model explained that 1% of the variance in pictorial representation and correctly classifies 62.3% of the cases. So the odds of males being influenced by pictorial representation is 20% lower than that of their female counterparts. So it could be deduced that gender significantly contributed to the model, which predicts being influenced by pictorial representation in the study. Now, the use of NSAIDs so on our discussion, the use of NSAIDs in the self-medication for pain had been implicated in many studies, and with the use of NSAID comes its adverse effects. Of the 652 responses received, 80.6% admitted that they self-medicated, with 7.6% as males and 42.4% as females. This is considerably high and similar to the study conducted by Motola in 2013, which had a 75.5% prevalence rate. The gender prevalence contradicts other studies that reveal that women are more likely to self-medicate than men, and that women are more prone to seeking health-related information. From our study, we discovered that paracetamol was the most self-medicated painkiller, although not an NSAID, followed by ibuprofen and the diclofenac, because some people talked about paracetamol in the study. So we tried to look at how paracetamol behaved, and we see that it is the most self-medicated, even though it is not an NSAID. This corroborates the study by those Esan, with a report that 75.1% of respondents in the study self-medicated paracetamol and 12.6% medicated with ibuprofen. So if you look at the chart there, you will see there that paracetamol in our own study was 23%, aspirin 2%, diclofenac 19%, ibuprofen 20%, naproxen 2%, and then others 34%. We also see that purchase of prescription medicines over the counter with pictorial representation adds to the challenge. Our study showed that there were most people that self-medicated and used these products based on pictorial representation purchased these products over the counter. And the time series analysis, like I said before, of the importation data showed high volume of diclofenac. This was validated by the high consumption of diclofenac among respondents. So we can see from the other charts, the bar chart, you can see there that diclofenac was the highest NSAID imported. And this high percentage of import may be as a result of the high level of self-medication of the product, as shown in our results, in the result of our study. There was an overall significant relationship between self-medication and pictorial representation on product packs of NSAID, as is 3.7% of those who responded. Of those responded who self-medicated indicated that they were influenced by pictorial representation on products pack. Now, what are the limitations of the study? Collection of data was carried out in a single point in time. We believe that if conducted across different geopolitical zones and time frame, different results may be generated. Extrapolation and generalization of the study may be difficult because of different socio-cultural behavior across the regions in Nigeria. And then we also look at the possibility of bias, asking questions, and the people responding, they may want to respond with socially acceptable responses and do false reporting. So there's still possibility of insincere responses and recall bias. The quantitative nature of this research limited us to determine the causality of analysis and the options or responses and the outcomes of the result that the results may not necessarily be true. The study did not have the qualitative aspect that would have been more flexible in approach and make provision for further explanation of reasons for responses to questions. So we didn't do the qualitative aspect of this research. If we had done properly, we would have been able to dig more and have more flexible responses to our questions. Summary and conclusion. This descriptive study has revealed certain challenges with the self-medication of NSAIDs among adults in the local government area. Most respondents admitted that they self-medicated NSAIDs, and the pattern of use showed inappropriateness with the risk of side effects, adverse side effects. And our study has shown that this can be compounded by the availability of NSAIDs in pictorial representation. Then we also discovered that access to unreliable information can be reduced through proper health information dissemination that could help improve health behavior among the population. The regulatory authority for medicines in Nigeria has to ensure that proper distribution of these medicines, NSAIDs, and access is coordinated so that people don't just get easy access to this drug, and especially with the adverse side effects of NSAIDs when abused. And then there is need to strengthen regulatory interventions that will prevent the manufacture, importation, and distribution of prescription NSAIDs with pictorial representation, and prevent the availability of those products over the counter in pharmacies and patent medicine shops without prescription from certified medical personnel. We also recommend the deployment of multi-component strategies that improve safe use of NSAIDs by the population and cuts across medicine control, regulation, distribution, and administration. And then there's need for aggressive health education and information among the population on the dangers and hazards of self-medication of NSAIDs and other medicines in general. And then there is need to strengthen efforts at enforcing strict policies that must be complied to among the manufacturers, importers, and distributors of prescription NSAIDs with pictorial representation into Nigeria. And then there should be increased accessibility to health services and medical personnel. Post-marketing efforts could be conducted to withdraw all non-compliant products with the pictorial representation from circulation. So that's another recommendation, that is strengthening post-marketing efforts and withdraw all those pictorial products with pictorial representation from circulation. So these are my references as used in the presentation. Thank you.
Thank you, Dr. Dunay, for the presentation.